The Florida Health Department is calling on the CDC to issue a correction after releasing what they say is misleading information about the number of COVID-19 cases in the state, saying Florida reported a record-breaking 28,317 new cases for Sunday. The state's health department responded, tweeting, "The number of cases the CDC released for Florida today is incorrect. They combined multiple days into one. We anticipate that the CDC will correct the record."
In late July, the CDC reinstated its mask recommendations for certain circumstances indoors, no matter vaccination status. The Delta variant now makes up 93% of cases in the U.S., according to the CDC. We have new Hill-HarrisX data on the health agency's handling of the Delta variant. Let's take a look.
Two months ago, 60 days ago, the CDC came out with the recommendation that individuals who are vaccinated do not need to wear masks indoors or outdoors. Something has changed, and what has changed is the virus. The CDC hasn't changed, and the CDC hasn't really flip-flopped at all. What's happened is that when that earlier recommendation was made, we were dealing predominantly with the Alpha variant.
The poll found that roughly 6 in 10 voters approve of the way the CDC is handling the spread of the Delta variant, with some stark partisan differences. 83% of Democrats and 54% of independents approve of the health agency's handling, while just 38% of Republicans agreed. Alyssa, what do you think of this?
Well, it is interesting to see how stark these numbers break down on partisan grounds. Listen, as a Republican, I'm shocked to see that 59% of the country actually approves of the CDC's handling. Their guidances from the outset of this have been giving us whiplash because they seem to change day in and day out. And I'm the first person to say this is a novel virus. We're learning more about it as we go. But this is what they do. Public health is what the CDC was designed to do. And the number of times they've put out a guidance, not in coordination with the rest of the interagency, seemingly not communicating to the White House, and then leaving the public just confused about what we should be doing and what the safest thing is. I mean, there's so many examples of it. So if anything, I'm surprised that roughly 60% of the country still approves of their handling. That said, it's kind of they're a necessary evil in the sense that we don't have an alternative right now. We're still in the thick of this, and we need the CDC to do the part of their work that's good while we get through this virus. Ryan, what do you make of this?
Yeah, what's interesting is that the reason that you wind up with this 6 in 10 being supportive is that Republicans are more supportive of the CDC than Democrats are hostile to it. So in other words, you have 38% of Republican voters saying that they support the CDC's handling of the Delta variant, whereas you have 17% of Democrats saying they oppose it. And that's the whole ball game right there. You throw in them being +8 among independents, and that's how you get this 60-40 or 59-41 majority. So in some ways, being surprised about this data suggests that we may be slightly overstating our assumptions about how hostile Republicans are toward the CDC. Clearly, they're hostile, 62% to 38%, but they're not as hostile as Democrats are supportive, which is 83 to 17. I mean, Kim, what do you think?
Yeah, that's what my takeaway was as well, is that that's a really interesting stat to see how many Republicans are actually on the side of the CDC and saying, yeah, this is not so bad. And that has kind of been even just my anecdotal experience as well, is that there's been a lot of Republicans who, they're very much like, we've got to get vaccinated, we have to wear our masks, we have to, they're actually way more compliant than I think a lot of the media sort of tries to make it seem like. And so, that was kind of my ultimate takeaway as well. My other question about this is, what could the CDC do better? I mean, if people don't like their handling of this, what types of things were they wanting to see the CDC do? That would be kind of my big question.
That's an interesting question. And Alyssa, I'm curious for your take on this. So if you have an alpha variant that isn't really transmissible among vaccinated people and in an indoor setting, it isn't creating breakthrough cases, that then gets overtaken by a Delta variant that is transmissible among vaccinated people and is creating some breakthrough cases, the CDC doesn't really have much of a choice then to kind of flip-flop on the indoor mask guidance, right?
Well, yeah, and that's fair. And just to be clear, some of the guidances, the early ones that Republicans were critical of about, don't wear a mask initially, then wear them, that was simply to save masks for frontline workers, a very valid public policy decision. My understanding, and
Still a lie, though.
my understanding, though, is I think in any time when there's sort of a crisis within our nation, people still want to turn to institutions. You need to know that there's got to be something that you've got to at least marginally trust. And the CDC is that. It's a brand that we understand. They are the ones sharing data with us. My biggest objection, frankly, is the lack of public communication around things. I'm all for the guidances if the science backs it, but what I think would be helpful for the many vaccine skeptics, myself not included, I'm double vaxxed and proud, would be if the CDC was proactively putting out information about why the vaccine works, how mild the potential side effects are, and that's where I've seen the biggest gap. That needs to come from scientists and medical professionals, not from politicians. They can't punt it to the White House. So that's been my biggest disapproval with them, but it's actually probably a good thing in terms of getting through the pandemic collectively, that the trust in the CDC is relatively high.
Well, thanks for watching What America's Thinking, and we'll see you next time.